Why you should consider carrying over-the-counter Narcan. You've probably seen in the news that the FDA recently approved naloxone, commonly distributed under the brand name Narcan, to be sold over-the-counter at grocery stores and pharmacies. Regardless of how you feel about illegal drug users, naloxone can make an invaluable asset to anyone's first aid arsenal. So let's explore how it works and why you should consider carrying it. Naloxone is an opioid receptor antagonist, a medication that can reverse the life-threatening effects of an opioid overdose. Opioids, such as heroin, fentanyl, and prescription painkillers like oxycodone and hydrocodone, work by binding to specific receptors in the brain and spinal cord called opioid receptors. These receptors are part of the body's natural pain management system and are also involved in regulating respiration. If you or someone you know is using opioids or is in an environment where opioid use is prevalent, watch out for these warning signs. Unresponsive or non-arousable. An individual experiencing an opioid overdose may become unresponsive, meaning they cannot be awakened or roused by normal stimulation. Slow, shallow, or labored breathing. Opioids can cause a significant slowdown in the respiratory rate. Pinpoint pupils. Contrary to the dilation you see in the movies, opioid overdose often leads to pinpoint or constricted pupils, even in low light conditions. Limpness and muscle weakness. The individual may appear limp or have difficulty moving. Blue or grayish skin and lips. Hypoxia, a lack of oxygen in the body, can cause the skin and lips to appear bluish or grayish in color. Gurgling sounds. The person may make gurgling or snoring sounds, which can be indicative of airway obstruction due to the relaxation of throat muscles. When naloxone is administered, it quickly displaces opioids from the receptors, effectively reversing the overdose's effects. This is crucial in preventing death from respiratory failure, one of the primary causes of opioid overdose fatalities. It's important to note that Narcan has a relatively short half-life compared to many opioids. This means that while it can reverse an overdose, its effects may wear off before the opioids do. In such cases, additional doses or medical attention may be necessary. So why carry Narcan? The opioid crisis affects people from all walks of life, and opioid overdoses can happen unexpectedly, even to those without a history of substance abuse. Narcan can be administered by bystanders while waiting for emergency services to arrive. The minutes saved by rapid intervention can mean the difference between life and death. Now that Narcan is available over the counter, there is a very low barrier to obtaining and carrying the product as part of an emergency response kit. If you have friends or family members who are prescribed opioids as part of a pain management plan or are struggling with opioid addiction, carrying Narcan can provide a safety net, potentially saving their lives in the event of an overdose, accidental or otherwise. By having Narcan readily available and knowing how to use it, we can make a significant impact in reducing opioid overdose fatalities and promoting community health and safety. Thanks for watching.